me clearly. America is not a racist country.
Ladies and gentlemen, racism in the medical field has been a long, ongoing problem in this country, and they do absolutely nothing about it. To me, when somebody displays a lot of racism towards patients that don't look like them, and that person is in need of medical attention, that should be automatic termination. But in America, it isn't. And another point I want to make, if you go to a doctor or you see a nurse and they are blowing off, because generally this is what I hear from a lot of the people in our community. They'll tell these nurses and doctors what their symptoms are and they'll blow it off and don't take it seriously. Two things you need to do. If this is a nurse, you need to report her. I don't care who she is. I don't care if she's been there for 1,000 years. If you tell someone that you're in pain or you need help and they're blowing you off, always, always, always report it. Don't ever let it go. Number two, if you are seeing a doctor under your insurance plan and the doctor is not taking you seriously, number one, contact your insurance company, report this doctor, and also switch to another doctor. Don't rest your life in the hands of any medical professional that is just straight up showing you they don't care nothing about you. What should happen to them? They should lose their patience. When they start losing a lot of patience, they'll get the picture then. But many of us don't have time to wait for these people to get it. So just switch immediately. Don't stick with people like this. You have no obligation to stick with them as a patient. You have no obligation to do that. So keep it moving. If you see behavior in them that you don't like, or you have a serious situation and they're not taking you seriously, get rid of them. Get rid of them right away. It says that people in the Black community do way better medically if you have a Black doctor. And it does make a difference. I know firsthand. So, Black Americans expect to face racism in the doctor's office, survey found. Well, you shouldn't. You should never expect racism in a doctor's office or anywhere. But in this nation, it's standard. It's standard. But there's a lot of things we must change. It must not just be political. We must change on a personal level too and start rejecting these doctors and nurses that do these things. Period. Okay. So let's get into this story. So many people, and they got to go with that people of color stuff, in this country say they have to change the way they dress and mentally embrace themselves for potential mistreatment when they visit the doctor. That's one of the sobering findings of a large new survey that probes the extent and implications of discrimination in American life, including healthcare. The survey was conducted by Health Research organization that goes by KFF. Researchers polled a nationally representative example of 6,300 adults. The good news is that among those that sought health care in the past 3 years, people reported having positive and respectful interactions with their health care provider most of the time. But the survey also uncovered troubling differences along racial and ethnic lines. Black, Hispanic, Asians, and American Indians, Alaskan Native adults were much more likely than their white counterparts to report having negative interactions during healthcare visits. Now, the reason why I got rid of a doctor that was one of them folks, it was because I didn't like the way he interacted with the patients, including myself. What he would do, and a lot of doctors do this, they'll book everybody at 10 o'clock. You go in, everybody got a 10 o'clock appointment. It could be 10 people in the lobby with a 10 o'clock appointment. Then they pack us all into these individual rooms, and the doctor is running from room to room. And you only get maybe 10, 15 minutes with the doctor, and then he run away to another. I was like, I don't want doctors like this. The doctor that I have now, they don't rush me through. They sit and talk to me. They answer my questions. They go over things if, or if there's medication that's being, a script being written, they go over everything on how the medication works and what it does. They take their time with me. I don't feel rushed. When I went to them folks, I always felt rushed. And that's why I switched. I'm like, look, one day I'm going to have a serious health problem, and I don't want no doctor that's going to rush me through. See, the moment you make me feel that way, I'm going to get rid of you. I'm going to get rid of you, and I'm going to get rid of you right away. I'm not going to wait. So I can understand how some of these people have negative interactions. Now, the number one complaint that I have seen all through the years with medical professionals when they're dealing with Black patients is they don't listen. That is the number. If you want to see what happens to Black women that are expecting or in the hospital about to have their baby, that is the number one complaint. When the baby is in distress, they ignore it. That's why so many Black babies are dying in there. They ignore it. Or when the mother is in distress or in pain or feels something is wrong and she tries to tell them, they get ignored. That's why the mortality is so high. It's willful neglect of Black women and Black babies up in the hospital. That's why, when you look at studies, this is why they say if you get a Black doctor to deliver your baby, the outcomes are way, way better. So, anyway, things like a provider not listening to them, not answering a question, or responding to a direct request, not prescribing pain medication. That's another big one. You know, they go on that lie that was taught during chattel slavery that we don't feel pain. And that garbage goes all the way back to chattel slavery. And you can see they still hold on to it even to this very day. That's why you should not be going to these people for any kind of medical help. Whoever you're going to, if they look like them and they're not listening to you and you got pain and they refuse to even talk to you about certain things, get rid of them. Get rid of them. We don't have time for this crap anymore. We don't have time for it. All right. So, for example, twice as many Black women who've given birth in the last decade said they've been refused pain medicine they thought they needed compared to white women. Numerous previous studies have found that Black patients are less likely to receive appropriate pain medication than white patients. And they're doing that on purpose, y'all. Doing it on purpose. Okay, so and overall, at least a quarter of people of color said that doctors were less likely to involve them in decisions about their care. In some cases, a survey respondents shared specific stories in which their concerns were initially dismissed. only later to be found to be a serious health condition. All right. So these type of experience with unfair treatment may help explain why large shares of respondents of color who took the survey said they took certain steps to prepare for healthcare visits at least some of the time. For example, feeling like they have to dress very carefully or take a lot of care with their appearance in order to be respected and listened to by their healthcare provider, or say that they sometimes prepare for possible insults from healthcare providers during healthcare visits. And 6 to 10 Black respondents said they are careful about how they present themselves and or expect to be insulted in healthcare settings. You know what? If you are insulted, leave. Leave. Seriously. You don't have to sit and be insulted by these people. When you go to that doctor is supposed to provide care to you. If they are sitting there insulting you, you should leave. You don't have to take that crap off of any of them. Another disturbing finding of the study that Black adults with self reported darker skin tones reported more discrimination in everyday life. 62% of Black adults who said their skin is very dark or dark reported incidents of discrimination in the past year, compared to 42% of Black adults who say their skin is very light or light. That I definitely believe. You know, I had a white man sit up in my face one day and said that to me. He says, "Oh, I'm okay with Black people. I just don't like the ones that are real dark." You know, that fool sat in my face and just came out and said it. I mean, it's unbelievable the level of disrespect they display. Yeah, I did call him out. And after that, he really didn't talk to me too much, and I really didn't care. People like that don't have to talk to me, and I won't miss them. I was fine. So, people of color were much more likely to report having respectful, positive interaction with their healthcare provider, shared their ethnic and racial background. So, in other words, if the healthcare provider looks just like them, they have better outcomes. That's in line with the growing body of research that has found patients of color are more likely to be satisfied with healthcare interactions and more likely to adhere to medical recommendations when their doctors look like them. 1% nationwide study found that Black patients live longer if they reside in counties with more Black physicians. That is true. That is true. That is true. You would even do better if your doctor is another, let me just say this way, non white. You would do much better. Even if you don't have that many in your area, seek them out. You'll do better. You'll do better. These folks, they just been way too overly conditioned to feel a certain way about us, to the point where if it impacts your health, then they're not even worth going to, for real. However, data from the Association of American Medical Colleges show Black and Hispanic doctors remain vastly um, underrepresented relative to their share of the US population. That's true, but they can still be found. Okay. If you can't find them around them, try to go near a city. The closest city to you, you'll find one there. You're more than likely to find one there. So there's a real opportunity here in terms of increasing the diversity of healthcare workforce to have positive impacts in people's interactions in the healthcare system. The survey was conducted in the summer of 2023 and is the first of a series of studies KFF plans to do on the effects of racism and discrimination. So, no, you do not have to accept bad health care. You're paying for health care, you're paying co payments. You don't have to sit there and accept that from anybody. You know, we got to learn how to, just let these people know you're not coming back. You'll find another doctor. And that's exactly what you should do. Sometimes you just switch. If you don't feel like even saying that, you have the right to demand another doctor, depending on your insurance and what type of doctors they provide. You got the right to look for those doctors that you do want that will treat you right. So, y'all, please tell me what you think about this video. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.